If you need to travel somewhere, you need to travel before this month. Most airlines will not allow travel after 36 weeks of pregnancy. Take extra care of fatigue and backache during travel. It's a good idea to circumscribe an A before traveling. Kindly see how this is to be done. You will draw an A with the tip of your toe, visualizing this tip as a pen. You draw A in the travel, then you draw B, and you draw C. So continuously in the travels, you need to draw A, B, C with both your legs. Then flex and extend the toes up and down and keep doing these movements. This is important to prevent any stagnation of blood in the veins. What are the other things you may encounter in a travel? You may be in a beautiful place, you may be sitting somewhere under a lovely tree like I am right now, but you may feel excessively tired, excessive fatigue. What can you do for this? Either go in the swimming pool and have a warm bath, or go in a pool and put a few drops of lavender oil in a small water tub and sit in that tub. Avoid strong jacuzzis in pregnancy. Many of the pregnancy spas, the one we conduct to, is specially designed to avoid fatigue at this stage. You have a beautiful relaxation massage in the spa and you do the meditation. A lot of your mental fatigue can easily go away. You may want to consider now, when you're planning for your baby or you're planning a childbirth, your previous birth history. If you're a second-time mom, you may have had a normal or a cesarean birth before. If it's a cesarean, you can always have a normal delivery again, what is called as VBAC, or vaginal birth after cesarean. If there are many repeated cesareans like the third or the fourth, which is not very much advisable, you need to watch for uterine rupture, placenta accreta, or bright red bleeding in pregnancy. What are the options you may have for birthing? Normal, cesarean, epidural, water birth. We often feel that there are many cesarean sections taken nowadays. How come the chances of cesarean are increased? The normal indications are CPD, or cephalopelvic disproportion, when your baby's head is very big and the size of the pelvis is relatively small. Fetal distress and meconium, multiple births, breech and unusual presentations, or any medical problem with the mother, some heart disease, placenta previa, prolonged labor, so on and so forth. Sometimes if a cesarean is told, the way you have visualized your delivery by pushing and labor, you may be, all these lovely notions may be displaced and you may feel very, very sad. But remember, most cesareans are very baby friendly. When we do the cesarean, Dr. Vikram has delivered the baby, we take the baby, do a little suction and immediately put on the mother's chest. This is called as birth without violence. Even though the cesarean is on from down, from the lower abdomen, the baby and the mother are getting to bond on the face, on the hands. She can say a mantra to the baby, she can talk to the baby. We remember to tell her, tell your baby name, say your fetal name aloud. So that will help. The increased chances of cesarean nowadays are because of large babies, large mothers who are relatively obese and their large age. If your baby is in a breech position, you may want to consider doing some exercises to rotate the baby. Walking helps a lot, yoga helps, back bridge may help. That is lying down and raising your waist up and holding on the ground with the support of your hands so that your buttocks are raised up. Leaning on a bean bag or crawling, imagine, on all fours in your hall will greatly help. Rocking back and forth a few times over your hands and knees with the buttocks higher than the back of the head will also help. Do pelvic tilts, that is kneel on all fours, go on all fours and rock your pelvis back and forth, back and forth. This will also help to get your baby down. Then go on your knees, sit on your knees, keep them slightly apart and bend over so that your butts are up and your belly is facing down. Do this 20 or 30 times. The reason why animals don't have a cesarean is they are quadrupeds and their babies seem to come out beautifully in this way. A large size of the abdomen, it seems as if two tummies have grown. Some of them may grow this way and you have a tummy in front. Some may grow this way and you have a large transverse tummy. Depending on whichever type of tummy you have grown, you can use a maternity girdle to prevent any sort of soreness or pain in the back or heaviness while walking. It's a good idea to check all the play schools, gardens in your area. Just like you're preparing your baby's nursery, when you come and go from your flat, just check around which are the areas you may want to take your children to and they may enjoy going in that area. What are the other concerns you may have? as a part of your health issues. One is urinary frequency and urgency. Important tips for this is to empty the bladder every 2 hourly. Especially when you're micturating, you lean forward so that the bladder can help to empty completely. Kegels exercise are the most important thing you must do in the antenatal and the postnatal stage. In the Kegels exercise, you will contract your urinary bladder muscles as if you're stopping the flow of urine. Remember, you're not to contract your tummy muscles or your buttocks or your even thighs. You're to contract only the urinary bladder muscles. These are the muscles you will feel when you're coughing, sneezing, laughing. You'll feel a little urine coming out. So you remember, when you think, okay, I think now I'm going to sneeze, you just cross your legs one on top of the other and contract the urinary bladder muscles. It may also help as an emergency at that time. If you're having too much of urinary incontinence, you can wear a sanitary pad off and on or a panty liner. Hard stool and straining at constipation can also make things worse. So use your pelvic floor muscles, straighten them up, and you must pass stool regularly. Sometimes you'll have more of urgency and hesitancy, but you'll not pass too much urine. So you've gone into a phase wherein mentally you're feeling that you'll pass urine. So try and mentally control that stage. Squeeze a ball in between your thighs, between your lower legs. You put a nice ball and you press 1, 2, 3 and release 1, 2, 3. This will again improve the bladder training. So instead of going to the washroom every 10 or 15 minutes, you may go in half an hour or so. There may be increased constipation in pregnancy. This is because the effect of increased progesterone or sluggish bowel, or the uterus puts pressure on the bowel. So you need to have daily 25 to 30 grams of fiber and a lot of green vegetables in your diet. You can have some vegetables with the skin slightly cooked on it, like peas and beans. This will prevent constipation. Wheat bran, which will help. Jawar, bajra, nachni, all these will increase the cereal in the diet. You can add wheat bran inside your chapatis, inside your atta, inside your dalia and cereals. This will also help. Avoid maida, as this causes constipation. Drink a lot of warm water with lemon when you get up in the morning and also at night. Eat early breakfast so that you can evacuate your bowels before you rush to office. 6 mini meals are better than 3 large meals. Iron tablets can cause constipation. Talk to your doctor about decreasing the dose. And you have a probiotic supplement that intestinal bacteria, the fiber will break down, and also that will increase the fiber content. In the 8th month of pregnancy, you also need to start visualizing your placenta. Your placenta is like a tree literally, in which all the branches are like blood vessels supplying to different parts. Bark of the tree is the umbilical cord through which your secretions are going. With these things in mind, you need to keep a watch on the other symptoms which you may face in the 8th month. And one is breathlessness. This is because of the large side of the baby's head. When it enters into the pelvis, you feel very big. Once the baby enters inside at the end of the 8th month or the 9th month, you get a feeling of lightening. You feel that relatively large bloated abdomen is a little better. What can you do if the big bloated tummy is making you uncomfortable? You sleep in a propped up position with 2 or 3 pillows, and you sit up straight instead of being slumped over so that your tummy doesn't come in the way. You'll also get a little discomfort or tickling between the ribs of your chest bone, what's called as rib tickling. The baby runs out of space and it is in the tummy like this. So it finds space for his legs by keeping his legs inched between your 2 ribs and with the head down. So that sometimes causes a pain in that area. And you can feel something inside here which is uncomfortable. Take a deep breath while raising your arms above your head. Exhale while releasing the arm, and eventually drop in the pelvis in the 9th month. So this will make it very comfortable. Braxton hicks contractions. These are practice contractions which you can get starting from the 7th month or 8th month or so. They last for about 15 to 30 seconds. Remember, you have to differentiate them from actual true labor. Braxton hicks contractions are not associated with opening up of the cervix. The cervix will not open up. Okay? And in these different positions, you will get these contractions. So these are practice contractions by the uterus. They don't occur at regular intervals like other contractions, and they don't increase. Regular true labor will always increase and will associate with dilatation of the cervix. You may have a labor show, you may have some water leaking down. Now what can you do when you get these contractions? They are a little uncomfortable. So to minimize the discomfort of these contractions, keep changing positions frequently. Avoid dehydration from time to time. Use these contractions in fact for your benefit. think that, okay, this is how my contraction is going to come. I am going to visualize, just like a tree, my placenta, my baby, and all the blood flow from this tree is ready for the delivery. And I'm going to visualize that I'm doing my breathing techniques and my labor and enjoying this part of the pregnancy here.